Good afternoon, everyone. I'm Harvey Fineberg, President of the Institute of Medicine, and I have the great privilege of welcoming all of you to this 24th Annual Rosenthal Lecture at the Institute of Medicine. This year, we're presenting a program. It will focus on the ways in which the language of the entertainment arts informs our cultural understanding of end-of-life care, and also how our attitudes toward the end of life inform and shape our cultural repertoire. The goal in curating this event is to enable us to look at entertainment and art as a catalyst to spark discourse. Discourse which may enable us to overcome obstacles that in everyday life inhibit our ability to speak openly and honestly about topics that touch us deeply, emotionally, and affect us every day. Sometimes, when it comes to end of life, we have feelings naturally of fear and also of denial, anger, sometimes a sense of helplessness. And these feelings can inhibit our ability to engage in open and direct conversation. These conversations, in turn, could help us to better understand the complexities involved in coping with and coming to grips with end-of-life and end-of-life care. These complexities in everyday life are only amplified and made even more difficult by the complexities of our healthcare system and the entanglement of emotion and technology that often accompanies healthcare toward the end of life. Through the generosity of the Rosenthal Family Foundation, this Richard and Hinda Rosenthal Lecture Series was established at the Institute of Medicine in 1988. Its purpose was to focus greater attention on some of the critical health policy issues facing our country today. And we've been especially privileged over the years often to engage the important topics of health policy with the revealing capacity of the arts in joining together as we will this afternoon and evening. I want to extend a very special welcome to Nancy Stevens Rosenthal and her son, Mick Rosenthal, the daughter-in-law and grandson of Richard and Hinda Rosenthal. Nancy currently serves as the president of the Rosenthal Family Foundation, where the work of that foundation honors the legacy of Richard and Hinda through their support of the arts and sciences, medical research, education, and human rights. Nancy is a lay member of the board of directors of the Union for Concerned Scientists, just one of a handful so designated, and also serves on the board of Americans for the Arts. So it's a wonderful privilege to have you with us, Nancy, and Mick, we're especially happy that you could be with us as well. This is a unique opportunity, in a way, to express our gratitude to 3 generations of the Rosenthal family for their support and their opening up this opportunity for us to learn and to share with one another. The topic of end of life, that is the subject of today's program, is one that is not new to the Institute of Medicine. Our work on this subject dates back at least to 1998, when the IOM published a landmark report entitled Approaching Death: Improving Care at the End of Life. It was a study that brought attention to what constitutes good care at the end of life and how can we deliver it. In 2001, the Institute released Improving Palliative Care for Cancer, and in 2002, published a report that focused on the very difficult subject, when children die, improving palliative and end-of-life care for children and their families. Next month, the Institute of Medicine will embark on a new consensus study, Transforming End-of-Life Care. We feel it's especially important at a time when it is so difficult for us in public and through government to come to grips with the difficult topic of end of life, for us to be able to step forward and to engage the subject tonight and in an ongoing, honest way. We want this new report to focus on many of the critical subjects that still beset this fraught topic: the delivery of care and social support in advanced illness and toward the end of life, patient and family and healthcare professional communication, and how we come to learn and understand our values and our preferences and to share those with others. How we can engage in advanced planning for the inevitabilities, and how we can face up to these questions in a responsible way as individuals, as family members, and as a society. All of this and more will, I hope, emerge in the course of our thinking together, stimulated wonderfully by this evening's presentations. It's now my great pleasure to introduce the moderator for this evening's program, Dr. Neil Baer. Dr. Baer is currently serving as a clinical professor of preventive medicine at the University of Southern California, but he's perhaps more widely known for his role as executive producer of the CBS television series, A Gifted Man. He also was executive producer for a number of other popular television programs, including ER and Law and Order Special Victims Unit. Dr. Baer graduated from Harvard Medical School in 1996, and he completed his internship in pediatrics at the Children's Hospital of Los Angeles. He received the Jerry L. Pettis Memorial Scholarship from the American Medical Association, this specifically for his contributions to promoting better understanding of medicine in the media. And he was also selected as a Mass Media Fellow by the American Association for the Advancement of Science. I know that you will join me in extending a warm welcome to an individual whose passion for social change is bounded only by his capacity for communication and persuasion. Please join me in extending a warm welcome to Dr. Neil Baer.